Hi, Tammy here from ESA Connection. Thanks so much for joining me for a vendor interview. We have Arizona Vision Therapy Center with us today. We have Dr. Amy and Janine, and they're going to talk to us about vision therapy. So let's just start out with the most obvious question. What is vision therapy?
So vision therapy, it gets it so that your eyes actually have the ability to work as a team. A lot of times people, as they develop, they don't learn how to use their eyes accurately. Just like when you're a baby, you don't know how to walk, you also don't know how to use your eyes accurately. We all assume that everything just pops out and you're doing what you need to do. It takes many, many years to figure out how to coordinate that. Well, if you get distracted, say if you have torticollis where you can't turn your head a certain way, you got stomach problems so you don't want to do tummy time, you're kind of have like an ADHD personality, you don't want to practice anything, all of those cause difficulties in learning the actual techniques you need to use your vision. So what we do is we come back and we clean up all the foundational skills that they need to be able to use their eyes together.
Oh, this is fascinating. What is the age range of people who need vision therapy? Is it only for babies, only for little kids?
No.
Oh, Janine saying
That's,
no.
yeah, no.
What are the ages?
The sweet spot somewhere around 5 to 14 years.
Okay.
Because that's when we know the parents can help them make sure they do their homework.
But our oldest patient is 91.
91, yep. So, and doing very, very well.
So. Oh, wow. So any range, if it just shows on, because you mentioned you do an assessment, but it's more than your 20/20 vision assessment. So tell me a little bit about that. Like, what does that entail? Because obviously you're looking for deeper things than just like they can see.
Yep. Okay, so there's 18 different visual skills. I'm not going to go through all of them.
Skills? Oh my goodness.
That's a lot. But the big one is trying to get your eyes to point in the right direction as a team, track together as a team, be able to cross, uncross, be able to fuse things so that it's nice and comfortable, be able to understand depth perception, be able to find your place when you move your eyes.
Oh, wow.
So not get lost. There's like 14 others.
No, I think the most common that you mentioned there that I hear a lot about is the eyes going different directions. Tell me more about that, because that's absolutely fascinating that our eyes will go different directions. They won't work together as a team.
Right. Usually that's an adaptation. If they can't get their eyes to work together as a team, they end up seeing it's like a double vision type of thing, or they have this really interesting headache either here or right here. So it's things that people can ask their kids, hey, how you feeling right here? Right? But when they go and they make their eyes in different directions, they shut down that headache. They shut down that double vision. They just ignore one eye and they go do what they need to do with the other eye. So parts of their life become easier, but the parts that have to do with depth perception and ability to communicate easily, look people in the eye, suffers a lot.
So you just mentioned something fascinating. So there's some physical signs that parents can look for that might be a symptom of a bigger issue where they might need vision therapy. So you're saying the headaches. What are some other signs related to a need for vision therapy?
Yeah, so the headaches, the double vision, the discomfort. They can't read for more than 10 minutes at a time, or even some of them only a minute at a time. So you'll see certain behaviors like avoidance behaviors.
Oh, yeah, for sure.
Yeah, they'll say, I hate reading. Ask them why they hate reading. Does it hurt their eyes? Do they not understand what they're reading? That's another one. If they're spending so much time just getting their eyes to point in the right direction, they're using all their energy to do that. They don't have enough energy for memory and comprehension.
Yeah. Oh, wow. Fascinating. I think that was a really good parent strategy, is when your child is struggling with something, don't just accept them, dig in and find out the reason why. Like, so when they're complaining, I don't want to do this, or I don't like this, because when you dig deeper, you're going to find some of these symptoms potentially, and you really can get to the root of the problem. And that's what vision therapy does. Okay, so what are some different levels of vision therapy?
Okay, so if it's just a basic type of thing, say they had developed their vision beautifully and they had a head injury or some kind of illness, and
TBI.
There it is, TBI, and they forget how to coordinate their eyes, then a lot of times we just put them in a pair of glasses that will help to guide their eyes back to what they had already learned. When they haven't learned it in the first place, that's when we have to go through the actual training.
So would this also be concussions for athletes and stuff?
Absolutely.
Do they come and see you? Let's touch on that, because my husband's an athletic trainer. So he deals with concussions like on a daily basis.
Yes.
And he's seen some significant concussion incidents in his career, including like personality changing, traumatic memories coming to the forefront, all these things. And so vision can be impacted as well. So talk a little bit about us in the, because is that a long-term vision issue? Is it short-term? Like so when a child gets a concussion, what should parents be looking for, and when do they come to vision therapy when they have a diagnosis of a concussion?
Okay, so the first big thing that happens is the eyes no longer want to be on the page itself. They want to be out looking for danger
Okay.
because they don't want to get their head
And
hit
you can
against.
visually see that.
Some people you can. A lot of people you can't.
Oh, okay.
But they'll have this look where they're not comfortable and they just kind of squint a little. Yeah.
So parents look for that squinting. If your kid has a concussion, look for the squinting. There's something to do with the eyesight.
Yep. When they read, a lot of times the words move on them or float on the page. Their comprehension really goes down.
Wow.
They fatigue very easily because they use up their batteries just trying to get their eyes to work together. There's so many different things that can happen.
So probably if your child has a severe concussion or a concussion, vision therapy coming in for, you guys do free consultations, right?
Yes.
So you can consult with them for free at any time if you're suspecting there is something with the vision. That's a really good point that you brought in.
Yep.
Another thing I want to touch base on, because I'm a special ed teacher, so I get this a lot because we have a lot of kids, especially today, after COVID and everything, and that delay instruction, disruption in instruction. Our readers are behind, very much behind. And so a lot of times parents will be taking them to vision centers to get vision therapy. So talk to us about that, how vision, and I feel like you already touched bases on this, but let's hit it one more time. Vision impacts reading. Tell us how.
Not just a little. Yeah, you got to get those eyes in the
same place.
Not just a little.
Not just a little. I love that because you're right. So tell us how reading or vision therapy is going to improve reading, not just a little.
It helps children to read faster, to take in more information because they're not too worried about getting their eyes as a team. It just makes life easier. It brings out less emotions because a lot of times, especially the COVID babies and the COVID children, they have learned to keep their energy going by using certain emotions like anxiety and frustration to keep them focused on their task. Or they have to have significant rewards to just read a book or a paragraph.
So this is going to make parenting easy?
Yes.
Is that what you're telling me? Parenting is going to be easier because your child can vision therapy because there's a deeper issue going on.
Absolutely.
It's all a trickle effect.
Yes. So there's so much that it goes into it.
Yes. I think that's maybe the biggest thing is we can just connect that if your child does have a reading issue, you need to go get this free vision consultation to rule it out that it's not that vision therapy isn't needed and there's not an underlying issue. Because I have heard a lot from parents that like the eyes are going different directions, or again, the common thing I think, especially with our learners who have severe reading issues, dyslexia, the letters are floating off the page.
Yeah, and that's the other thing about dyslexia. So you can have dyslexia and you can have a vision problem.
Okay.
They're actually separate entities.
Okay.
So if you try to train the dyslexia and you still have the vision problem, you're going to be spending a lot more time training the dyslexia. So if we can get them comfortable and able to actually get into the page and look at it, it's going to be quicker.
Okay, so we talked a lot about vision therapy and the benefits. What does it look like? This is an unknown entity for a lot of families, a lot of parents. And so like you have a sold on it. Like it is essential. There's so many, like you said, it's a foundational skill. And we need those foundations to be able to do the higher level academics and everything, right? So what does this look like when a client comes to you and come and do vision therapy? Because you did mention that parents are going to have some input in this and some responsibility with homework outside.
Yes. Okay, so for the basic one where we give them it's about 2.5 hours for the initial exam.
Okay.
For the basic ones where we just give them glasses, they just wear the glasses for about a month and then they come back and we readjust the glasses and we do that for about 6 to 9 months. Okay, that's for the basic one. If we have to do the actual training, then what we do is we bring them in and it's once a week. It's an hour per week and then you do 10 to 15 minutes of home support.
Okay, 10 to 15 minutes of home support. That's it.
A day.
Yeah.
Until we see them the next week.
Right.
So about 2.5 hours a week involved in getting this together. And we bring them in, it's one-on-one with a vision therapist, and they teach them the skills as if they were to have learned them as a baby.
Yeah.
But they're not the size of a baby anymore. So we have to modify a lot of the techniques to fit them and customize to them.
Yeah. And to get the engagement as well.
Yes.
I'm sure you have some resistance because it's outside the box.
It's got to be exciting.
You probably don't have a friend that went into vision therapy.
Yeah, exactly. So this right here is a simulation of something called convergence insufficiency.
How do you say that again?
Convergence insufficiency.
Okay, convergent insufficiency.
Yeah, it's a horrible name.
Twister.
Horrible name. It implies that you don't have the muscles that it takes to converge your eyes or to cross your eyes. That's not true. It's more that you're spring-loaded. And when you try to do anything up close, you have to put a lot of muscle into it. And then after a while, your muscles give out and You want to look out in the distance, and then you got to put some muzzle into it again.
Exhausting.
So, yep.
Yeah.
So this one simulates what it feels like as you do that.
Oh.
Okay. All right. So I want you to go ahead and put these on top of your glasses.
Okay.
Now she's keeping her glasses on because this isn't a 2020 thing.
They put them the right way, or
yeah,
do
you
put
put
them
them
the right?
perfectly.
Yeah.
Yep.
Okay,
I want you to look at my finger right there. Okay. Keep it single. Keep it clear. Got it.
Okay.
And then I want you to look way out in the distance over there. Okay. There you go. Keep it single. Keep it clear. And then bring it back in again. Okay, you notice how you got some really interesting feelings going on in your head?
The strain.
It's
Yeah,
strain,
that
yeah.
strain. Oh my goodness.
Yeah.
Wow. And so that's what's going on for a lot of our learners' brains.
Yep.
And just that fatigue in the eyes as well.
Yep.
Oh,
And
Looking
that's
down at
usually
their
right
paper,
here. Yeah.
looking up at the whiteboard, copying. It's straining and it's hard. And that's when they want to give up.
right.
Yep.
Right. Well,
And they
wouldn't
do.
you too? I mean, I would want to. It's hard,
Yep.
right? So, all right. Well, we really appreciate you guys having you on today to explain
Yes.
about vision therapy and some science to look for and absolutely the benefits. Is there anything else you would like to share with our listeners before we end the interview? Any last thoughts?
I would say just give us a call. If you think your child is struggling or you notice your child is struggling in school and you want to get a free vision screening or just even a consultation to see what we do at our office and how we can help your child, give us a call, schedule a consultation, and we'll get you taken care of.
Awesome. Thank you. Thanks so much for coming on today.
Oh,
Thank
that's
you.
awesome. Thank you.